Hi, this is Dr. Kelly Pearson back, and we're going to talk about dairy. We've got 4 sections to cover over the next few webinars, and one of the problems that we have is we don't like talking about the things we don't want to get rid of because it scares us that it might be very painful. But I have some good news ultimately about this concept, so hold in and hang on. First of all, I feel a little bit nervous talking about dairy to lots of people because it does feel anti-American. I mean, my goodness, just a few decades ago, we had milkmen deliver milk to our doors along with cream. And we have sadly really noticed a significant change in dairy over these many years. And we're going to talk about some of these things. Now, this may seem a little inappropriate, but I can't tell you the number of patients that have said, so I can't have any milk or eggs. Remember, eggs, while white, don't come from cows. They come from chickens. So eggs are not part of this conversation. That's just one bit of good news we can get started with. So as I've been in practice for over 30 years and I've seen a lot of challenges with chronic pain conditions, these are the questions I commonly ask myself when I'm talking to patients and certainly ask the patients themselves. First of all, do they have ongoing pain? Is it chronic? Is it more than 6 months old? Does it come and go and it's been noted for several years? Sometimes dairy is the culprit here. Is there a general sense of overall stiffness, or they might say I'm a little arthritic? That's very common with people who are dairy insensitive. And then a very, very common condition is that of constant sinus congestion, the need for medication to relieve a stuffy nose. Dairy can do this, as well as the tendency to be constipated, where you may go 2 or 3 days without a bowel movement, or you have to take a supplement to enhance bowel movements. And sadly, most of us don't recognize that a healthy person should be having 1 to 2 bowel movements minimum a day, food in, food out. And lastly, if they're really struggling with releasing weight, they try everything and they cannot let go of weight. Often this relates to dairy and the problems around that. It's not just lactose that you're going to find out about here in a little bit. So my question to you is, how sick and tired are you of those problems with fatigue and sinus problems and pain and inability to lose weight and on and on? The question I ask is simply because if your pleasure out of eating ice cream is far greater than your challenge around your ongoing symptoms, likely you're not going to make change yet. You really have to be sick of it. And when you are, you will make shifts. And if you are, what I want you to do is continue with the rest of these 3 modules, because we're going to give you lots of tips about what you can do and why that will make life much better. I promise.